Hey guys, today we're going to be talking about oncolytic biotherapy, and this is a new cancer treatment that I'm going to propose as a solution to cancer therapies and why it's a better treatment than chemotherapy and radiation that we use today. So according to the Cancer Institute of America, cancer is now one of the top 10 leading causes of death in the United States. So unfortunately for all of us, this means that probably 3 out of the 4 of us in this room are going to die of cancer. So why this is a harmful fact and it seems bad, there are actually different ways for us to treat cancer, and this new way is actually very beneficial. So to begin, what is cancer? So cancer is an abnormal growth of cells in the human body, and what this does is you have different cell regulation checkpoints in your body. So what this does is the different phases, G1, S, and G2, as well as your M phase, which is just simple mitosis, you have different checkpoints. So at these checkpoints, usually they don't work, which causes cancer. And this is usually caused by a mutation in the gene that codes for the checkpoints. According to the Cancer Institute as well, the most common mutation is at the P53 gene, and this is a regulation point at the S phase. So what this does is it causes that checkpoint not to work, which causes the abnormal growth of cells. So cancer can happen anywhere in the body. It's known as a systemic disease, which means it affects the whole parts of the body once it's done. So there are different types of cancer treatments right now, which is chemotherapy and radiation is the main treatments we use today. But as you can see in the diagram, there are other treatments such as surgery, immunotherapy, and targeted therapy. So with things like surgery, it's not as helpful because when cancer starts to metastasize and grow throughout the whole body and become malignant, so surgery isn't a good option because you can't stop it. Surgery is only beneficial for small benign cancers. The problems with chemotherapy and radiation is that yes, they do help, and the point of chemotherapy is to go in and attack the cells using different chemicals, and radiation is just shooting gamma particles at these cells, which breaks. But the problem for these treatments is that chemo and radiation target the healthy cells as well as the cancer cells around. So in an article titled "How Chemotherapy Drugs Work," the author states that chemo is good, but it also attacks the healthy cells because there's no control around. And what this does is that if anyone had a family member or anyone that's gone through cancer treatments, you can see that when they go, their whole body is affected. So it's not just the cancer that's affecting them, the treatments as well. Their immune system is compromised, and just their whole well-being in general is compromised. And you can tell that in these patients because they're often tired, they just look sickly as well. So there's different side effects that go along with this, and a lot of them are dealing with physical and mental. So the physical side effects obviously are the body starts to break down, the healthy cells are deteriorating, and it just causes a big load on the patient. And these mental side effects come with it because the patient feels as though they can't do anything when they're like this, and they also feel that their families can't do anything to help them either. They're just kind of stuck there. So this takes a big toll on them as well. So how can we solve this problem? Over the past 20 years, a new cancer treatment known as oncolytic biotherapy has arisen. So what is this new treatment, oncolytic biotherapy? So oncolytic biotherapy uses viruses, and in a study done by Arthur Mahoney at the Institute in New York for cancer treatment, they've shown that what this treatment is that they're using a virus. So when a virus attacks your body, the virus codes as an antibody, and it codes on the cell, infects your cell, and multiplies within that cell. And when it multiplies so much that the cell can't hold it, the cell breaks apart, and the virus goes into the other part, harming the body. So what these scientists want to do is take the virus and go in and use that to infect cancer cells. So the first virus to be used was the herpes simplex 1 virus, but other viruses are now being used, such as the adenovirus, vaccinia virus, and So now it may seem startling that we're infecting you with viruses, but it's not too bad. How it actually works is that once the scientists code the DNA in that virus, the virus enters the bloodstream, finds the cancer cell, and marks that cancer cell as bad, and inserts the virus into that cancer cell. So what this does is that cancer cell then has an antigen against that virus, so the body sees that antigen and sends out antibodies against that antigen to break down that virus throughout the body. So it kind of works as like a vaccination does in your body when you're born. We enter a low dose of the disease into your body produces antibodies against that, so when you get exposed to that antigen later on in life, such as like the flu, when you get your flu shot, this is how it works as well, your body is able to fight that off. So there's different clinical trials that show that this has been working, and a recent study in 2007 done by Fu Wang and Tu Yang in Japan, they showed that this actually decreased the tumor growth in cancer patients, and they're using this in cancer patients not just like, it's all types of cancer. So they've done this in just simple bone cancer and brain cancer and other tumors throughout the body, and it is showing a decrease in cancer cells. So as you can see, this is a chart from that study that was done. The control shows that there's no cancer treatment, and then the H1N1 is the virus that was included in there. And you can see that the response rate went from 13% to 30.4%, and this shows that the cancer treatment of the virus therapy was actually working. So where do we go from here? So the main point to go from here is that we need to have a different change of perspective on the virus. So like I said before, it's kind of daunting if you just go out to the general public and say, look, we're going to infect you with a virus to help you treat your cancer. Not many people are going to be knocking down the doors to get there. So what this does is that we need to have a different perspective on that viruses aren't bad, but they're actually good. And in this case, we can change our perspective on this to help heal and treat cancer. Another way we're advancing this into the future is that we can use viral therapy in other diseases. There's currently different virus therapies being used on genetic disorders such as cystic fibrosis, and that's having decent results as well. So I hope you all learned a little something about oncolytic viral therapy and how it can help change cancer